But I just want to welcome everybody back, especially people who have been around for the last couple of days. It's been a great workshop. We're into our kind of our last session. But I also want to thank Nikki and Maria for coming so far, which is not an easy place to get to from Toronto, and being so patient with us. They had a long day on Tuesday. And in addition to that, we're going to give them a little parting gift here, which they know is coming because they've been asking about this all week, is they keep asking, what is this Cougar Gold stuff? And so they've been warned that the whole thing about cheese in a can, I know that sounds bad, but it's going to be awesome. So kind of as a parting thank you note, I'm going to make sure they leave with a can of Cougar Gold. And just so you know, depending on where airport you're in, sometimes it's a problem. It goes best in your luggage. The Pullman Airport knows all about it.
Thank you. So the final session, first of all, can you hear me? And if you can't at the back, please just wave at me because there's no mic for the room. So we're going to try and project, but we might forget at some points. So the final session of the last 2 days, I guess, or day and a half, is on assessment. So we've been talking a lot about instruction, instructional principles, and the ways to maximize training for adaptive expertise, and part of that is integration and integrated instruction. And we've also mentioned, I think in passing, and some of you have heard, I hope, the imperative and the need for alignment between instruction and assessment, right? So you can instruct and care about all sorts of things in your instruction and try and have students learn in certain ways, develop their conceptual knowledge, do all sorts of things. But then if you go back to assessing other things, there's going to be messages from students, or that students are taking from that. So this last session is really about thinking about assessment for learning. And before I start, I'm going to give credit to our colleague Mahan Kulasegaram, who's not here, who's a scientist at the Wilson Center, and who is truly our assessment expert. So at the end, we should probably put his email up. If you have questions, you can refer them to him, or we'll pass you along. But we hope to do his work justice and some of the work we've done together some justice. So I want to just start off by reminding us all of why this matters. So when you see a statement like "this will be on the test," what do? You perk up, start writing, start taping. So there's a lot of, we can see how students respond to the knowledge that something will be on the test. So assessment really does drive learning. It drives student engagement in important ways, and whether we like it or not, that's the case. So assessment tells learners what to know, and it tells learners how to know it. Because when they get to that assessment, they figure that's what matters the most to this institution, to this program, to the profession that I'm training to be in. So what we want to do is create assessments that support preparation and integration. So for the last few days, we've been talking about integration. So integration that Nikki spoke more about this morning and a lot yesterday as well. So the need for integrated instruction and having that integrated understanding of concepts that provides you with that deep conceptual understanding of whatever domain of learning you're in. And preparation, which we spoke about yesterday in terms of how we prepare people to continue along the path of expertise. We don't produce experts at the end of a 4-year, or 6-year, or 8-year curricula. What we do is we give them the knowledge that they need in order to go out into the world and continue to develop their expertise. So those principles of preparation and integration, we've talked a lot about the ways that we can foster that and support that through instruction. And I think that you've all come up with a lot of innovations or things that you do in your own work that do that. But assessment needs to continue that message. We need to have that alignment between instruction and assessment. So in health professions education, in professions education across the clinical domains, there are a lot of challenges. So we have large numbers and limited resources, we know that. There's this push constantly for more authentic assessments, and we're going to problematize that a little bit. But this idea that, if I really want to know how well somebody's learned, I got to put them in that real context and see how they perform. And what does that mean, and what does that tell me, which we'll talk a little bit more about. But whatever, when Nikki started yesterday morning, she said how we know it isn't so. So that might be one of those truisms we might want to challenge a little bit. And it has to be meaningful to students and teachers, and depending on the context, I guess maybe with animals, I don't know how meaningful the patients will find it, but I think their outcomes probably matter to animals and humans alike, and patients certainly care about what it is that we're training people to value and do in the work that they're doing. So assessment drives learning, and I think I've said that about 5 times already. So students tend to focus on material that's tested. It helps them appraise the relevance of that material. And often what winds up happening in curricula is students wind up learning and teaching to the test. So Nikki and I actually ran a study with a student of ours who's a nephrologist on it. He created a really well-designed e-module on hyponatremia, and it was designed along principles of guided discovery followed by direct instruction, which we talked about yesterday as a form of productive failure. It was this lovely module, and we put it into the curriculum, and we didn't really control. We offered it to students and suggested that they might want to look at that before they did some case-based learning. And I don't remember what percentage of students, 10% out of 259 students in our each year of our, well, this is the first year of the medical school curriculum, looked at it. And then about 2 or 3 weeks later, they had the mastery exercise at the end of the course module. And then it shot up to like 80% that suddenly looked at it. So the value of that instruction was only deemed necessary to them if they thought that it was valuable for the assessment. They didn't really think about it as being valuable for the instruction that they were about to receive, which is what we intended it for. We thought it would be a really good foundational basis for what they were about to get in the instruction. So those are things that, you know, we don't always control, but we can see that that is an example of how assessment really drives what students consider relevant and important to them. So that learning and teaching to the test, we also get a lot of stories from faculty who tell us that they get the highest ratings on learning on their evaluations when they teach to the test. So students really like that. This comes up on evaluations. She talked about material that wasn't on the exam. This is not a good thing, just so you know. Right? So this is something that we hear from students, and we sort of roll our eyes a little bit, but this is a real concern, right? Students really think that if it's not going to be on the exam, why are you wasting my time? So again, assessment drives learning. And if it's not on the exam, and if you actually tell students that in any way, this is what happens. This might be a real picture. So thinking about all of that, and I think painting the picture of why assessment matters and how important it is for alignment, we have to think about the learning goals of our curriculum. So what are our instructional goals? And how are we going to further those goals through alignment of our assessment practices? So I want to ask you, what are some of the goals for your curriculum? We've talked about a few things over the last few days that we would maybe articulate as the goals of the curriculum that we've been working on at U of T. But what about you? I learned from a colleague to just wait. Yeah? So readiness, smooth transition to practice, yeah.
And maybe not dissimilar to that, but smooth transition to other classes as well.
Right.
Especially if we're teaching at the very beginning.
Right.
We want those students to be prepared so they can pick up wherever they left off in our class. We can jump right in so they don't have to reset their knowledge every time they go to a new class.
So being attentive to the trajectory and the development of students as they move through a curriculum and having assessment further that, yeah. Is nobody going to say adaptive expertise? I'm right here.
Well, I was going to say, similar to what we talked about yesterday, is flexibility and adaptability
Yep.
to problems, changing problems.
Thank you, Lynn.
Flexibility and adaptability to changing problems and new situations that they're going to encounter in practice.
Yeah, so preparing them for the complexity of real practice
Yes.
in all the different ways. And I would say conceptual understanding. Yeah.
As a director of CE, I'd like them to have a strategy for continuous learning.
So lifelong learning and yeah, figuring out how to learn from your practice and access learning resources, absolutely. That's a big one.
I'd like to see that we build some resilience into them. Our profession has a high degree of suicide and unhappiness, 5, 10, 20 years out, and it would be nice to graduate people who can manage the stresses and the pitfalls of our profession.
Yeah, I think that's a great one. Resilience is something that's been coming up a lot in the medical curriculum as well. And what we've been thinking a lot about is how to integrate resilience into how students develop their expertise. So thinking along the lines of some of the things that Nikki's been talking about lately, not having resilience as something that sits over here, but rather have it be really part of who you are as an expert in whatever domain you're in. Yeah.
So I guess maybe my ideas are not super kosher, but I guess I would like them to know things that I think are important.
You'd like them to know things
Like,
that what? Sorry?
Something that I think is important based on my specialty. I mean, I think that we all kind of have our niches at this level where we think, you know, I have something that they really need to know, and I really think that this nugget of knowledge is important for the future. So it's not like a very lofty goal, but it's sort of like today I just was teaching about antimicrobial susceptibility testing, and I feel like that's really important for them to know. So there's sort of these like core things that you just are like, you have to know this, oh my gosh, please. And whether it's truly important, I don't know. I mean, like in the grand scheme of education, but it's just stuff that you sort of like latch onto that you feel very passionate about, that they should absolutely know this thing. So.
Yeah. Core concepts, things that are core to the profession, things that are foundational to the profession. I think you're right to think that those things shift across time and across people, but nonetheless, that's a really important thing that you might want to make sure you're assessing, right? So this is all really great, and it shows us sort of the gamut of things that we might want to ensure that students are valuing. So the things that we care about the most are the things that we want students to value. And assessment is really a good way to signal that in fact we do value it. I remember I was visiting UCSF, and students were giving me an example of a project they had to do that was, I won't get into the details, but it seemed like a very valuable project and work. And they said, oh, but it doesn't count. It's not going to be assessed. And that immediately lowered the value of that particular form of content, even though it was being deemed increasingly necessary to the curricular goals of the school. So those types of messages, sometimes people and curriculum designers forget inadvertently to re-embed that, because they think, oh, well, you know, we have enough assessment already, but it does matter. So we had some down, so we thought, you know, integration, which Nikki can talk to you later about the fact that nobody said that. Preparation for future learning, which we talked about yesterday, as a key capability of what it means to be an adaptive expert. So really, the idea that you could possibly learn everything is not going to be enough, so we need to prepare students for that future learning. Dealing with complexity, which I think was raised before, adaptive expertise, broadly speaking, lifelong learning, which was also brought up. This can go on, and each curriculum is going to have to decide for itself what are the key things that they want to reinforce and key principles they want to reinforce in their students. But whatever they are, those things need to be reinforced through instruction and assessment. So the question then becomes, is our assessment practice aligned with these goals? Have we done a good job of aligning the assessment with the goals that we've defined for ourselves, whatever they may be? So there are a lot of challenges and deficiencies in this exercise. So there's gatekeeping and hoop jumping. There are a lot of things we have to do. We have to be accredited. We have to ensure our students are prepared for licensure exams and all sorts of other things that sometimes don't always align with our own learning goals in terms of what we want to be doing in the curriculum that we're developing. There's expectations of certainty. So, you know, we want to be sure that we're doing the right thing at all times and making sure that we're all producing the same kind of student. And students have a lot of dissatisfaction with the learning environment, and that really does drive a lot of assessment practices. So, you know, when students evaluate a teacher or something as being bad, that might have, I think, undue weight in how we then decide to proceed in terms of what we're going to do for instruction and assessment. So there's all these sources of the term up there is deficiencies, but challenges, I think, that are maybe blocking us from sometimes doing what we want to be doing in terms of assessment for learning. So we have a lot of choices, or well, two. So we could fix the assessments. So we could say, oh, we're going to fix them. We're going to make them better. We're going to change this. We're going to change that. And that, I think, might be sort of an endless task of trying to chase after a moving target constantly. Or we can find ways to use assessments for learning. So we can find ways to think about the ways in which the assessments that we have can be used more productively to foster the learning that we want. So previously, and I think that this idea of assessment for learning has gained a little bit of traction in literature. I don't know how many of you have heard the term. So previously, the main focus of assessment was on measuring the outcomes of the learning process. And that's, I think, a traditional form of assessment. This approach is often referred to as assessment of learning. Currently, a second notion has gained ground, which is the idea of assessment for learning. So how do we use assessment to, in fact, reinforce the learning that we want our curriculum to achieve, rather than simply measure the outcome of whatever instruction we provided? So instead of seeing the idea of assessment driving learning as a threat, and I've given you all the reasons why we could think of it as a threat and all the ways in which it could be a pitfall that we can fall into and negate all the impact of our instruction, I think instead it is productive to think of it as an opportunity. So what can we do with our assessments that will enhance what we're trying to do with our instruction? How can we do that most effectively? And I think, not surprisingly, we're going to go down to the level of cognition to discuss how we're going to do that.
Shock of all shocks. Cognitive psychology has the answer, which is usually what happens. So we're going to talk a little bit about one of the mechanisms by which assessment can be used to drive learning. And by far the most robust finding in the literature that I think is relevant to this conversation is the test-enhanced learning effect. And essentially what this effect shows, it started off in the psychology literature, was looked at even more in the higher education literature, and has more recently been brought into health professions, medical education, nursing education, dentistry education literature. And essentially what this shows is that when you provide students with a test, their learning increases. They learn more if you test them. So this has been shown a number of different ways, and certainly testing has been shown to be superior even when compared to equivalent amounts of study time. So you give one group of students some material, you give them an extra 20 minutes to study that material. You have another group of students who get the same set of material, and instead of giving them 20 extra minutes to study, you give them a test. And what we find time and time again, the students who had the test perform much better on later transfer tasks than the students who had extra time to study. So testing has a much better effect on long-term learning than equivalent superior study time. The key thing to think about, or to know when you're doing this, is that it's actually independent of feedback. So sometimes when people think about test-enhanced learning, they assume that the mechanism by which it works is that you give the students the right answer to the test. That has nothing to do with it. So even when the students do not receive the correct feedback, having the test, just taking the test, actually improves their later performance. And we can see this effect both on retention tests, depending on how the test is designed, but more importantly, for our purposes today, you can see this effect on application tests. So it's not just your ability to recall the information, it's your ability to use the information to solve clinical problems and to actually practice your profession. This has been looked at across multiple contexts, and there have been a number of different studies, some that look at pre-test versus post-tests, and you see the effect in both forms. More recently, as I said, this was initially established in the cognitive psychology and higher education literatures. People like Bjork, people like Nate Cornell, they were doing a lot of this work in psychology. And more recently, we've been seeing people actually, some of those original theorists are now doing work in health professions education and showing that the effect still holds. So this isn't just true for students in high school and students in kindergarten. We're seeing the effect right up into the health professions. So one of the studies that we see cited a lot in the literature was by Croman and his colleagues, and what they looked at is actually the effect of a test on resuscitation skills. So they had people enrolled in CPR courses, and at the end of the course, they either provided them with a test or provided them with just feedback. And what they found was the people who took the test were able to retain their skills over time when they tested them again 3 months out. There were other studies that were done by Larson that actually tried to augment the testing effect by having people learn through self-explanation. So basically, during the time of learning, they embedded tests into the learning phase. And what they found was those embedded tests improved performance over time. And that was, again, in a medical context. More recently, our colleague Mahan Kulasegaram, I've included his study here since he's the one who's the kind of guru of testing and assessment. What he actually did was do this work in CPD, so in a continuing professional development context. And so we're all familiar with the idea of CPD. Everyone is kind of forced to participate in all sorts of courses and programs. And Mahan's question was, could we use the testing effect to get more meaningful experiences out of CPD? And so he worked with a large group of course facilitators who were offering various CPD modules, and he worked with each facilitator to develop tests of the material. So what they did was they actually gave the students who were enrolled in these CPD programs tests that were provided before the module, and then they were able to take the module, and then they were followed up with tests after the module. And of course, the quality of those tests varied. When you're asking random people to create materials for your study, some people do a really great job, some people not so much. So depending on the quality of the material, the testing effect was stronger or weaker, but across the board, he did see a benefit to including this pre-post testing in his CPD courses. So I think it's fair to say test-enhanced learning works. But of course, if we're going to make this work in our curriculum, we need to know why it's working. You see the integration link there for people? We're doing a why. Why does test-enhanced learning work? You have to understand the mechanism. And the truth is that there's multiple mechanisms by which this is hypothesized to work. We don't have all of them nailed down, but I'm going to give you a rough idea of where the field is generally going with this. There are both intrinsic effects of taking a test, and then there's some kind of intrinsic and direct effects of cognition, right? The learner cognition actually changes. The first thing that's kind of a direct effect, so what this basically means is just taking the test, the activity of being asked a question, having to think through the answer and generate a response is what psychologists call retrieval practice. It means that when you're given the test, it actually forces the student to actually recreate the experience that they're going to create down the line when they actually need the information. It actually focuses on getting them to practice retrieving the information from memory. And that's what you want people to do when they leave your school, right? We're going to give them all this information. We're going to train them. When they have a patient in front of them 2 years down the road, 5 years down the road, 10 years down the road, we need them to be able to retrieve that information from memory and apply it to the patient in front of them. Testing is practice at that retrieval process. So it's literally a practice effect. It's retrieval practice. The reason this works is because it's rooted in some of the fundamental notions about memory. A lot of times people think that memory is kind of this box. It's a storage bin. So I have an experience. I learned some information in my teaching. I plunk it into this mental box. And later on when I need it, I'm going to pull it out of the box and use it out in the world. Psychologists have abandoned that version of memory. That's not how memory works. Memory is not static. What happens when you need information down the line is you reconstruct it. Okay? You reconstruct memory at the time that you need it. We're constantly doing this. This is actually why you can have memory errors. It's actually why you can misremember something. It's because every time you recall something, you're reconstructing it. What we need to do is give students practice with that reconstructive process. Okay? And so every time you retrieve, you re-encode information. We have encoding and retrieval. Every time you retrieve, you're getting practice re-encoding it. And so that's why the testing effect actually, or that's one of the hypotheses of why the testing effect works. It also challenges or actually incorporates some of our ideas around desirable difficulty. It makes the task just a little bit more challenging, allowing you to practice this higher order skill. Think of the students who are given that extra study time, right? Just giving you some more time. You're not going to use that extra time to challenge yourself and to test. Well, some students do. Most students in those experiments did not use that time to challenge themselves. They used it to keep reading. Right? So often students who are left to their own devices to study more frequently simply use the opportunity to give themselves more and more exposure to the material. So they just read it again and again and again and again. The challenge with reading something over and over and over again is what you're actually doing is creating perceptual fluency. So Maria's talked repeatedly about procedural fluency. This is perceptual fluency. The more practice you have reading something, the faster you're going to get at reading it. This convinces or tricks your mind into thinking you know it better. You don't know it better. You're just faster at reading it. So we all have experienced this when you have to proofread your own work, for example. If you write a paper and now you have to proofread it, after you've read it a couple of times, you no longer see the errors because you're actually not reading it anymore. You're just skimming it. Okay? So this is exactly what we want to avoid with giving students ample time to simply review and review and review and recall. You want to challenge, and a test can allow you to do that. So how do we use this information? Often when people hear this, they're like, okay, test-enhanced learning works. I have the solution. I'm simply going to have more formative assessments in my curriculum. And in medicine and really across the health professions, the idea of using formative assessments is very, very popular. So a formative assessment, in case someone doesn't know what a formative assessment is, a formative assessment is giving a student an assessment opportunity, a testing opportunity, but you're not going to actually hold it against them. So it's a test that you're going to give to them, and you're giving it to them for their own information along those lines. So a lot of people take the testing effect and decide we're going to do more formative assessment. And I don't think there's anything wrong with that. That's a reasonable take-home message. But I do think it's a missed opportunity if you stop there. So we want to actually move beyond formative assessment. And we want to say, we're not just giving you lots of tests for your own information. We want to use this formative assessment. We want to use the testing effect to drive learning. How can we actually use this, not just as an outcome measure and not just as a cool tool, but to actually help the student learn better for the future? One way to do that is through using programmatic assessment. And this is actually something we are doing at University of Toronto. We've been doing this now for 2 years, and it's been a big part of the MD program. What programmatic assessment does is it gives students an opportunity to demonstrate and to actually take small formative assessments at different spots throughout the curriculum. All of these formative assessment opportunities are put into a learner chart, and this gives us now a picture of how the student's doing across the board. The key thing here to keep in mind is we're no longer just doing kind of one-off formative assessment pieces. This is giving us an opportunity to get a centralized big picture idea of how the student is doing. And we're not using it to actually penalize them, but what we can now do is have them sit down with a mentor, sit down with a coach, sit down with someone who knows and says, you know, let's look at how you're doing and let's see where you can do better. Let's see where the gaps are. If you tailor these assessments correctly across the board, you can get a really nice picture of how the student is doing, a really great snapshot of their overall development. And we do this strategically by creating tests that we know will challenge students. We create tests that we know they're not going to do well on, and that we can actually use them instead to get an idea of their procedural knowledge and their conceptual understanding. So it's a lot of work, but there's a lot of benefits to taking this approach. And we do believe that taking this type of controlled approach to formative assessment, actually the benefits outweigh the fact that there is a lot of work that's involved. The first thing is that, of course, it gives students more feedback. And I don't know about the students at your school, but our school students are always complaining that they don't get enough feedback. No one told me, I had no idea, I need more feedback. And sometimes it's difficult to understand where that's coming from. And our faculty kind of say, I give them feedback all the time, right? Unless you sit them down and say, I'm giving you feedback now, they sometimes don't recognize that this is feedback, okay? So the learner chart, the programmatic assessment, everyone can tell that's feedback. So you can't tell us you didn't get feedback. We have a whole learner chart and we gave you lots and lots of feedback, okay? It also gives you more data on which to base that feedback. So you're no longer requiring that one faculty member take it upon themselves to try to convince a student that they have a knowledge gap. The student can always argue that this is an isolated incident. So it's not that I don't understand, it's that your test was unfair. It's not that I don't understand anything, it's that you asked silly questions. When you have an entire programmatic assessment in front of you, it's very difficult for the student to now argue that they actually don't have a knowledge gap, because we can see it in their learner chart. So it gives you more data. It allows you to identify learners who are in difficulty earlier on in the system so that you're not catching them at the very end when they fail the licensing exam or don't match for residency or something like that. It also allows us to assess more competencies at a greater level of complexity. And the key thing is that if we do this well, then you're focusing on learning and not your ability to take a test. Everyone understands that there are some people who have difficulty with certain types of testing, whether it's anxiety, whether it's the idea that they bring in past experiences and they kind of talk themselves out of doing well right at the beginning, right? We're not looking at test-taking ability. We also use different types of assessment. So if MCQs aren't your thing, but you actually do really well on in-class examinations or on other things, we can see that in the learning chart. So it's no longer an issue of test-taking ability. So all of that is great. We can have lots and lots of assessment, but you have to be very careful because what we haven't brought in is the key take-home of all of this, which is that even programmatic assessment and virtually any kind of assessment still has to be aligned with our program goals. And if you're not careful, then programmatic assessment simply turns into more assessment, not better assessment. So yes, we want students to have a lot of opportunity to get feedback, but we don't want to just overwhelm them with lots of assessments for no real reason. The point is to be strategic and to carefully construct this opportunity so that we're using these assessments to drive learning. And so what you end up doing is you create an assessment map, not based on the content coverage, but on your curriculum and program goals. So it's no longer saying, where are we teaching this one thing? It's what are our assessments that are driving preparation for future learning? Where are our assessments that allow us to see integration? Where are assessments that are allowing us to emphasize lifelong learning? Those are the types of things you're mapping in your programmatic assessment. Any questions about that? Because I know it's kind of a new thing for people before I keep going. Yes?
Programmatic assessment then isn't really something I can just start trying to do in my class.
No. So you can't just start it on your own, because then it'll just be you. But what you could do within your own classroom is you could identify what are the goals for your course, and you can still align your assessment goals to, you can align your assessment to those goals. So within a single course, you can still have almost like a mini programmatic assessment, but you can't do an entire learning chart across the board, if that makes sense.
Then where's the grade come from?
The
is
grade?
The question I can think of
Oh,
saying.
so that's a different issue. So, the totally different issue. So our learner chart is not about passing or failing. The learner chart really is to give us some idea of how students are doing and to give them feedback. Do you have something to say about it?
Well, yeah, so there are assessments that do count.
Right.
Don't worry.
Yeah, some assessments count.
But I know they would be.
Yes. Yeah.
So they also live in the learner chart, but in a sort of, it's clear to the students what is the formative piece and what will be basically the basis of a discussion with their academy scholar, who's their partner and the person that's assigned to be their coach and mentor, and what are the pieces that are the things that are going to be your pass-fail. We don't do grading, we do pass-fail at UT, so the students were competing a lot. So we should know that. So yeah, I'm muted. Sorry, YouTube. Yeah. So.
Yeah. So it's not like we've abandoned all other
no.
tests. There are still summative. You do still have to pass.
So on the learner's charts, it looks like there's a lot of data mining, and it's like a brain map or a knowledge map which is custom for each individual student.
For each student.
So when you provide feedback, are there instances where students have really no idea as to what's actually going on, where they're weak, and they just suddenly realize that and does that impact then how they move forward?
Yes, so there's more evidence to be discussed around the feedback question, but essentially the question around feedback links to the idea that people are really bad self-assessors. Students are very bad self-assessors, but everybody's a bad self-assessor. And you can't really train people to be better self-assessors. That's not really the point. But what you can do is provide more data and feedback to allow people to get a realistic understanding of where they fit. So self-assessment doesn't always rely on too much data or feedback. It's sort of one of those things we're supposed to be good at. But the idea of the learner chart and the idea of the coach is to help people interpret data for themselves. So you're not trying to tell somebody where they are, you're trying to give them the data so that they can understand it. And you're not counting on their ability to self-assess, you're counting on their ability to understand data. So that's a little bit of a different thing, if that makes sense. And that's the feedback literature, which is a whole other area of evidence that we've brought into the curriculum.
In a typical semester, our class might meet 40 to 45 times, and we'll dedicate maybe 4 of those sessions to be our normal exams where we would do tests. With the addition of several more exams throughout the semester, do we eliminate lectures and put in other tests there, or is this a where we split a class in half, or you have a scheduling suggestion on this?
Yeah, so it's up to you really, but what we do is we have courses that run in our program, so on different weeks. So let's say a course is about a 3-week period, so we'll do the mastery exercise or mastery test at the end of the 3-week block, and that will count. That is the summative sort of, it counts. But then each week we'll also have a quiz attached to it, and that's the feedback and the formative piece. So that's what we've decided to do, and we're still learning to see how well that's gonna play out. The students are a little bit upset because they don't always do well on the quizzes, and they have a lot of trouble with the understanding that they don't count. So yeah, but we're working on it. You know, it's a culture shift too.
Yeah.
I think I understand, but so your formative pieces, the students get the test back and they see their answer, so they get feedback on the formative?
Yes, yes, they
ones?
know.
Okay,
They know
so right
what you're
away.
doing. Yeah, so but as Nikki said, and I think we'll continue to say, the item quality matters. So even on the quizzes and the mastery exercises, you still need to be really attentive to the quality of the question you're asking, because you're still giving messages. So you can have a lot of formative assessment, but you still need to be asking the right questions to point students in the direction of where you want them to go.
Yeah.
But yes, they do get the answers. What right now we're playing with how much explanation they need to get for the wrong or right answer, because, well, there's questions around how useful that is or when to do it, and we get really nerdy right now. So we'll just
We had
leave
a
that.
very long, unbelievably nerdy meeting about what
That.
the format should be, and it went on
It was
a very
meeting.
long time. And you can get really into the weeds on this about what should you say, how many sentences?
So do they need to know the answer is wrong? Do they need to know why it's wrong? Do they need to just get an explanation of the concept, but no idea if their answer was actually wrong? Just an explanation. You know, there's a lot of questions. So,
Yeah.
just to give you a taste.
Yeah, it was fun times.
Yeah.
So, okay, so there's a lot of ways that you can do this, and obviously as a group, as a community, you'll decide kind of what will work for you. But this is certainly one option, and it's something that you can consider. And at the very least, if you don't go to a full-on programmatic assessment mode for everybody, the lesson here is really about thinking carefully about your formative assessment. We don't want students just randomly taking true and false questions at the end of every lecture for no reason. What was the purpose of the test? Is it aligned with your goals? Is it driving learning? Like, these are the questions you want to ask yourself, even if you don't go the whole shebang.
I have a question.
Yeah.
From the instructional design standpoint, what kind of support do y'all help all of the instructors? Because that's a
Yeah.
massive task.
We're getting there. Yeah,
okay,
you
you're
wait.
good.
Yeah, you're going to be busy. If you're
So I will say though that, yeah, we'll discuss the items and how to do that, but this is a centralized effort. This is the difference between, in our program, the program and course levels for instruction are very program level. The week sessions, as we were discussing with a group of people before, are sort of driven by smaller groups of faculty who are content experts. Assessment is at the program level. This is we have an Office of Evaluation Assessment, which is wrong. It should just be assessment, but we won't discuss that. But we have an office, and this whole program effort is quite centralized, including the item banks that we're using for the tests. But we do rely on faculty to create those.
So the core, if you're going to make any level of assessment, whether it's programmatic assessment, things you're doing in your individual courses, work for you. The other concept you have to understand from cognitive psychology is transfer. And we talked a little bit about transfer in the session this morning. But essentially what it means, transfer is the ability to actually apply and use knowledge. So as I said, the whole aim of education in any context is transfer. Right? We're trying to teach someone something today, have them store it in memory, and then be able to use it in a problem down the road. They're going to be able to transfer it to some other problem. And so we expect this as part of our program. It's all over our program. So we set up opportunities for learning and retention, whether it be in the classroom, whether it be in clinics, and then we actually expect them to extend and adapt that knowledge when we actually have them in front of patients in practice. And so transfer tasks are all over the curriculum. It's everywhere. Whether you actually have identified this or not, you can be guaranteed it's all over. So we might have someone learn anatomy and physiology in the classroom, and then later on we expect them to transfer that knowledge to an MCQ test. We might have someone learning LP on a simulator or learning any kind of skill on a simulator, and then we expect them to transfer it to an actual patient. We might have people learning crisis management, disaster management in a simulated setting, and then we expect them to be able to transfer it to managing a real patient, to managing real crisis. That's really what we mean by transfer. As we acknowledged this morning in the previous session, spontaneous transfer is exceptionally difficult to achieve. So students don't just spontaneously transfer content from one area to another. It's something that we as educators have to support and encourage and provide the knowledge in the right form to make transfer easier. We talked about one way to do that this morning when we talked about that careful, explicit integration of basic science. That supports transfer. As a general rule, the process that we're talking about when this happens is called transfer appropriate processing. So what that means is that we have to think about the cognitive process that's actually being encouraged at the time of learning, and then think about the cognitive process that's going to be needed when you're going to apply the knowledge. Okay, so there's going to be two cognitive processes. And what transfer appropriate processing means is that there's a relationship between the process of encoding information or memory and the process of retrieving the information at the time of future learning, problem solving, or performance. That's all it really means. So we want to actually support the type of processing students are going to need later by requiring that type of processing now. That's what transfer appropriate processing means. And when you create that match, you get transfer. That's why it's transfer appropriate. See? Nice and clear. I have a study to explain it. I know it's not that clear when I say it that way. So this is actually linked back to some work that was done by Needham and Begg in 1991. These were psychologists at McMaster University. And they wanted to really understand the idea of transfer. How can we get students to transfer information? And so what they did was they actually studied problem-oriented processing. So students were actually trained on problems. So they were given a problem to solve, and they were actually given the solution to the problem. Now, Needham and Begg were not studying health professionals, so the problems are just these kind of like cute insight problems that aren't really relevant to health professions, but the process is still the same. One group of students is assigned to the memory-oriented group. So in that group, we say, here's the problem. I want you to remember the solution. It's going to be useful later. That's what you say to that group. The other group aren't given a memory orientation, they're given a problem orientation. And so you say to that student, here's the problem, here's the solution, tell me how this solution is correct. Why did this work? Think through it. Did everyone hear me say why? The group that I said this morning, right? Why is this the right answer? And the student has to work it out, explain why the solution works. Then we test them. We give them an opportunity to transfer. And so we test them in two ways. We either give them novel problems, and so these are problems that are related and could be solved using the same solution. So if you really understood the solution from the first time, you can solve these novel problems. We also give them a recall assessment and test their memory for the solution. What we find is that on the recall test, the memory-oriented group far outperforms the problem-oriented group. So they remember the solution better. Great. In solving a new problem, the problem-oriented group does better. So even though the memory group remembers the solution, they don't use it to solve the new problem. The problem-oriented group doesn't really remember the problem that they were given before, but they're able to use the knowledge to solve the new problem. Which group of students would you rather have treating your patients later on? It's the students who can actually solve the new problem. So why does this work? Why do we see this effect? And again, Needham and Begg, the 1991 paper was just one study. They did many of these after the fact. And the reason that this works is because recall, or the reason you see this, recall has a completely different cognitive process than application. Okay? And what we know is that when you ask people to think through a solution and explain why, you're activating the same problem orientation, the same cognitive process that you need to solve problems in the future. And so the goodness, when you're trying to figure out, is this a good question? Is this a good assessment activity? What you want to understand is what's the goal of the activity? That's how you decide if it's good or bad. You don't base it on the structure. You don't base it on anything else. You base it on what's the cognitive process that we're going to need to evoke later on. So the goodness of particular acquisition activities must be defined relative to a particular learning goal. Essentially, what you're going to do with the knowledge dictates how you should learn it. So in some instances, recall might be appropriate, but you have to decide when is that the right process. So it's all about processes, not just content. This allows us to challenge our idea about what makes an authentic assessment. So historically, and not even just historically, in recent years, authentic assessment means high fidelity, right? So it means that you have a really pretty realistic simulator, and you make sure that the simulator looks exactly like the patient is going to look in the future. And if you can test them on that simulator, that's a more authentic assessment. But when you think about transfer appropriate processing, now authenticity has nothing to do with fidelity and the prettiness of the simulator. It has everything to do with the authenticity of the cognitive process elicited by the assessment question. That's what matters more. So the implications for this is that for transfer to occur, you actually have to evoke transfer appropriate processing during learning. And we talked a little bit about this morning, how you might do that. The format of instruction matters far less than the type of processing that's evoked. And what we have to focus on during instruction is both content and knowledge processing. So the outcome task has to be understood. We're going to have a pop quiz because it's an assessment workshop. Get it? So test-enhanced learning. Everybody, no collaboration. Can't ask your neighbor. You're not allowed to ask Siri for help. You have to come up with the answers by yourself, okay? So the questions are going to come up on the screen, and your job is to say the answer, okay? Everybody ready? No asking Siri. In what year was the Needham and Begg study published? Oh, nice. What's the definition of transfer appropriate processing? Who wants to try it? Who wants to give me a definition? Yeah.
Learning is in the same context as the assessment.
Close. Ish.
The learning employs the same cognitive processes as the assessment.
Perfect, exactly. So we're evoking the same cognitive processes. What are some potential implications of transfer appropriate processing for assessment? It's harder, right? So I'm not going to actually make you guys answer that one because I want you to answer this one. What type of processing did each of the questions I just show you evoke? The first question is what kind of question? It's a recall, right? It just evokes basic recall. You have to hunt down somewhere in your memory, and it actually is still a retrieval question. So what tends to happen for that question, if it doesn't come to you right away, you try to, your mind tries to recreate the circumstance in which I said the year. You try to reconstruct that and see if you can remember me saying it. And I deliberately said it 3 times to make sure that you had 3 opportunities for that. When Mahan does this, he only does it once, and then no one gets it. So I deliberately did it 3 times. Okay? So that's a recall one. The definition of transfer appropriate processing, a little bit still recall, right? Because it still kind of says something, it's still tougher than the Needham and Begg, but it's still kind of a recall. Asking someone to tell implications is an application question. Because now they have to think, okay, what is transfer appropriate processing? What does it mean, okay? And then now use it to come up with some implications. Now the reason I stopped you there is because when we do this in a group setting, people try to remember if I had a list of implications, and so now they're going back and trying to think if I had a list. There was no list of implications. There was a slide that said implications, but it was implications for something else. So that's why I said I'm not going to make you guys try to do that. But the implication question is an application question. Okay? So each type of question evokes a different type of processing. And if we're going to maximize transfer through assessment, then we have to think carefully about each type of assessment, decide what type of processing that assessment is evoking, and then decide if that's aligned with the goal of learning in this context. Okay? So, in what year did which year did the War of 1812 begin? And then you give a nice multiple choice option for the year. This does not evoke deeper cognitive processing. Okay? In fact, this is a matchy-matchy question. It makes no sense. And so the challenge is people think that if you do MCQs, you're automatically going to turn into this type of question, and you're never going to be able to get that kind of deeper processing. The key thing is that you have to take the time when you're creating an MCQ, when you're creating any type of assessment, to think carefully about what we call response process. What actually happens when the student sees the item in front of them? What type of processing is going to be created? So recall is one of these response processes. So some items elicit a recall response process. It causes the student to try to look back for a specific fact and pull it out of their memory and put it onto the page. And so this is things like true-false questions. This is like our what year did the War of 1812 start? Single fact questions to just name something. What's the right dose of something? It doesn't require any actual understanding. It's just a recall question. But you can also have application questions. And so recall questions, the response process is factoids, memory. Application, anytime you're asking someone to make an inference about something, that can be considered application. When you're asking someone to make connections, that's also application. Okay? And again, we talked about that in the previous session, the importance of using these opportunities to make connections. So essentially what you want to do as educators, if you're going to use assessment to drive learning, is to really harness the response process. The assessment itself is a simulation. It's a mental simulation. And you have to think to yourself, what am I going to do to prompt this student to engage in the response process that I want? And you structure the assessment to support that. So to build a test, we have some really easy steps. You identify the appropriate processing during learning and transfer. You check for alignment with instruction, and then you validate the response process. Let's try it out. So we're going to do a small group activity. We're going to have you go back in, well, not back into because we have new people. So maybe just sit amongst yourselves in groups of 4 or 5, whatever, just small groups. And I want you to think of some of your current assessment tools. I want you to also think about some program goals that you have. If those goals are integration, if those goals are lifelong learning, if those goals are deep understanding. And I want you to think about how well some of those tools map on to some of those goals. Do you have any assessments in your current toolbox of assessments that you think do a really great job of picking up on integration? Are there any assessments in your toolbox that do a really great job of enhancing and driving conceptual understanding? Okay, so we're going to go through that activity. Then what I also want you to do, because I do know a lot of people are doing formative assessments in their classrooms right now. We heard some examples earlier on. If there are people in your group who are using formative assessment, take a moment to jot down for yourself or to share with the people in your group, what type of processing do you think your formative assessments are evoking?
Are there any any insights you've come to around your assessment tools and the alignment with what you want to be doing with your program? You want to share? Yep.
Uncertainty of efficacy.
Okay, that's a good insight. Yeah.
All the time we had, that's what I heard you saying. Not sure it's working.
If you're not sure if your instruction is working or your assessment is working, or both.
I guess the biggest thing was are we actually writing an item that is assessing integration and the process that we're aiming for effectively.
Yeah, and that's a really difficult challenge to set ourselves. I think it's worthwhile to do and to try and do well, but I think you're right to think of that as sort of the big question always. Any other insights? Has anybody thought a little bit about the type of processing most of their assessments might be evoking? Yeah?
A lot of recall.
A lot of recall, yeah. Yeah.
It's a recall and processing, right? The two different.
Yeah, well, yeah.
For the processing way, have we to use the memory for the connections and create the action situation for processing, right? So the memory will be involved at some point for this process, right? Or not?
For the
Yeah, like we're assuming the information is in memory. So we're working on that assumption. So it's there, hopefully. So all the things we did at the earlier sessions, your guided discovery, your direct instruction, all those things are intended to store the information. The question is, how are we going to use assessments now to encourage that information storage and to encourage the encoding in the way they're going to need it later on? So we've talked about instructional design pieces. This is now using assessment to serve the same goals. If that makes sense.
So if you, I don't know, I don't think you were here yesterday. So we talked a little bit about productive failure. Were you here for, yeah. So for productive failure, if you recall in that study, in the outcomes, in the assessment phase of that study, we had 3 different types of items. One was recall, one was application, and one was the preparation for future learning. So how well somebody can learn something new and then solve the problem. It turns out that when you instruct students in using productive failure as an instructional intervention, they can do well on all 3. So, you know, whatever that you've evoked some sort of parallel process, and we've been debating what exactly that would look like for this particular example. But I think what you might sort of be asking is whether or not you still need the recall and the memory ability even when you're doing application and everything else. And yes, and you can teach for application and conceptual understanding and get recall as a byproduct of it. If you teach the other way around, you won't get conceptual understanding and application. You'll only get recall. Does that sort of address it? Yeah.
One question I had was, I don't understand, how do you assess lifelong learning?
So we've been assessing preparation for future learning, which is a little bit different from lifelong learning, but I think it measures the ability of somebody to how well somebody's prepared to learn with the knowledge they have. So who's familiar with constructivist models of learning, right? So typically we learn based on what we know. So we use what we know to scaffold our future learning. So preparation for future learning is really the idea of what kind of knowledge are we giving students that better prepares them later on to continue to learn. Lifelong learning is a little bit different because it gets into things like motivation and adult learning theory and sorts of other things attached to that particular construct. We tend to focus really on the quality of the knowledge, like integrated conceptual knowledge, and how that form of knowledge then helps students in situations of novelty or whatever they find themselves in to scaffold their new learning on that knowledge so they're able to perform well in that new situation. So that's how we're thinking about the most important aspect of future learning. And lifelong learning is a related construct, but it's a little bit different, and we haven't really touched too much on that. So, yeah, Andy.
Can I ask a question as I pass it on down? I'll talk and walk. So I was looking at processing and formative assessments, and are you guys familiar with the mini CEX? And
yeah.
So we have something similar to that in our 4th year. So what kind of, and it's we consider it a formative assessment, but I'm not sure what kind of process that's evoking for the student.
So, it depends. The mini CEX thing is tough because it depends highly on how you use it. So sometimes the mini CEX doesn't evoke any kind of processing because it does this weird thing where people are evaluating others and then the emphasis is on what the other people do. Other people do it where they set up kind of stations and scenarios, and then the question is, what are they doing in the scenarios? Well, it kind of depends on how you do it.
Ours is more case-based.
Yours is case-based?
Not scenario-based. We have a real performance on handling a real case.
Okay, so then the question is what you require them to do with each case. And so if the activities and actions that you expect them to do with the case are emphasizing integration, are they emphasizing deeper conceptual understanding? Could I get away with just showing you the procedure even though I don't understand why I'm doing any of the steps that I'm doing? Now we have an issue, because now what you've done is you've taken this complicated task and you've essentially still only assessed recall. I'm assessing, do they know the steps? You have no idea if they would know how to do that if you change the scenario slightly, because they don't know why they were doing the steps. So it really so it can go either way. So that's why we keep saying it's really hard to paint broad brushstrokes and say it should be PBL or CBL or mini CEX. It's all about how you use it, because you can take one of these tools and use it in a way that's just reinforcing recall. So it just kind of depends on how it's structured.
So I have a question, maybe it's a little bit off topic. So you talked about for the formative assessments, ideally we should be doing it for our students, and it's not something we self-assess, but shouldn't we be training them to be more independent and to be self-reflective and continually evaluating their own thinking patterns as opposed to saying we're the best to assess them? Shouldn't we be training them so that they can assess themselves?
So I think that, I mean, I guess the short answer is a little bit is no, in the sense that there's really a strong evidence base to show that you cannot train people to be good self-assessors. We are simply not good self-assessors. But what you can train them to do is use data more effectively. So what we've shown, and there's a number of studies that are looking at feedback-informed lifelong learning, for example. It's the ways in which you train people to think about the cues and the feedback that they're getting in the clinical environment and how they're going to then think about their practice based on that feedback. You're not relying on some sort of metacognitive, oh, that I didn't do very well on that, because people aren't good at that. Like people, who's a good driver? Right? So,
I'm not.
Right.
The patient dies or the client
Well,
is angry at you that then you...
So you know what?
Oh, I didn't do it well.
That's actually fascinating though, because a lot of people will say, well, the patient was unreasonable, or the patient, well, not because they died, but they,
How unreasonable of them.
if they're angry at me, you know, it's not me.
Yeah.
It's not me, it's the patient. Or if they have a bad outcome, well, you know, that's just the way the world works sometimes. Or, you know, people are very good at rationalizing their own behavior, and that's a pretty stable finding in the literature. But if you teach people to, well, there's a lot of pieces in this. You also have to create organizational structures that basically demand that people attend to certain forms of data as feeding back into their own understanding of their practice. So people aren't allowed to ignore or rationalize or, you know, separate things out. But if you leave people to their own devices, they will very poorly self-assess. Most people, for example, take CPD sessions that they are good at already. They don't go to the ones where they're actually pretty bad at what it is, whatever the topic is. And that's a well-known finding as well. So self-assessment as a metacognitive process, no. But self-assessment in terms of interpretation of data and feedback, yes, is the short answer. And again, we could devote another series of talks and workshops to that topic. So it's a whole other thing. But yeah, sorry, go on.
Okay. No, I'm going to keep going.
Yeah, go.
That's it. So, okay. So one of the things that we talked about earlier today, and we've been talking about for the 2 days, is this idea of developing conceptual understanding and conceptual knowledge. So the mini CEX is a perfect lead-in to this discussion. We really want to see that people are able to use assessment to drive deeper conceptual understanding and not simply rote memory. So what are some easy-ish ways? Someone asked me for tips earlier. Actually, I think the guy who's leaving asked me for tips. So now, what are some tips? What are some easy ways to use test-enhanced learning to help students develop deeper conceptual understanding? The first thing that comes in that we're going to use here, and that's really a robust finding in the literature, is the idea of using mixed and interleaved testing instead of blocked testing. So typically, blocked testing is kind of a mainstay in education. Essentially what it means is we teach a concept, we provide a test, and then we move on to something else. So teach one concept, teach one test, one time. So in statistics, our example is usually things like the t-test chapter is followed by a bunch of t-test questions, and then we go on to the chi-square chapter where there's a bunch of chi-square questions. This is blocked assessment, okay? What we know from the literature is that that's not an effective way to develop deeper conceptual understanding. What that teaches the student is not, because who cares if you know to do a t-test after I tell you this is going to be a t-test question. What I want the students to be able to figure out is when do you do a t-test versus when do you do a chi-square. And in order to know that, I have to do what we call mixed practice or cumulative testing. Okay? And so what that means is that we test multiple concepts together. You were talking about this morning, teaching multiple different contexts, different organ systems, these kind of things all at the same time and mixing it up during the assessment. And we want to do that repeatedly. So what that allows students to do is actually ignore the surface level, forget the procedural fluency for a minute, and think about the deeper conceptual understanding. Why is this a t-test question? And so it's really, really easy in education to get sucked into doing blocked assessments when we're not paying attention. So being mindful of when are you doing blocked assessments? Are there things that you're doing in a blocked fashion that you can switch up and assess in a mixed fashion or interleaved fashion? You'll get a lot more out of those assessments. Yeah.
Will that be the systems approach that we commonly do?
Yeah, so sometimes it can be done in systems. Some people do it like life cycle approaches. There's lots of ways, but the whole point is to try to help to use variation in context and variation in structure and surface to your advantage, because variation helps. Oh, that way, sorry. That's huge blocks. So you can do it that way. So it depends though on how, imagine, I'm trying to think of I've seen people do systems-based, but still kind of mix it up. So I'd have to see what you're actually doing on a day-to-day basis. But yes, sometimes it can be all the cardiovascular questions, and then you move on to respiratory, then you move on to something else. Yeah. So it can be like that too. But this can happen at 2 different levels. So it can be, again, program level, course level, session level. So this can happen at any level. So it's just being mindful of where you're doing it. Someone might decide blocked program is okay because that's the way we have to do it, but then are there opportunities to mix things up at the session level? That might be a way to achieve it. So variation matters. Variation is really important in assessment. And if you want to use assessment to drive learning, variation is key. We also talked about using assessment to drive integration. Or actually, no one mentioned using assessment to drive integration, but I'm mentioning using assessment to drive integration as a key program goal. So if the goal of your program, and I did include some of this for people who weren't here, if the goal of our program is that we want students to develop integrated understanding of basic science, clinical sciences, social sciences, and if we make that an explicit goal of our curriculum, we know that the result of this can be that students get better transfer of knowledge, that they're able to solve new problems, they're able to solve more complicated problems. And we've also already showed you that integrated learning requires integrated teaching. The challenge with this is there aren't a lot of assessment practices that have been designed to support and evaluate reinforcement of integration. So we've done a lot of work on the instructional design side. There hasn't been a lot of research on the assessment side, so it's still kind of a new thing. And there aren't a lot of tools that are available to us right now to help us understand whether or not a student really has integrated understanding. So I wish I could just say, use this test, you're good to go, but there aren't kind of validated assessments for this. But that's a good thing, because it means as a community of scholars and a community of educators, we can start to think about how can we use our current assessment tools to assess and test integration. So I'm going to show you an item. So I'm going to go, for everyone who is here, it's going to be tough if you weren't here for the cognitive integration discussion, but if you were here for that, I want you to think back to our definition of cognitive integration. So integration that happens within the mind of the learner. A student who has an understanding of an explicit mechanism that explains a clinical sign or symptom. Okay? I'm going to show you a test item. You tell me if you think this item could potentially be assessing cognitive integration. Okay? So it's an MCQ. Referred pain is caused by, and then there are a list of options for what explains referred pain, or what could cause referred pain. Don't worry about the answer. Just tell me, I actually don't know what the answer is, but tell me if you think this would kind of get at cognitive integration. Not sure, you're thinking? Okay, let's try this. Variation is useful. I'm going to show you a contrast. Let's try this item. So now we have a 45-year-old man suffered from a severe head injury with bilateral frontal contusions. He had a formal neuropsychological assessment, which included the Stroop test. On the test, words are written in the color that is different from what the words actually mean. For example, the word red might be written in blue or green. On this test, he will be required to, and then it lists what would happen on a Stroop test. Does that seem like a cognitive integration question? No, it's easier to see in this one. Why is it not a cognitive integration question? It's a procedural knowledge question. So this is just a fancier way. Both of these are still definition questions. So this is a fancy way of saying, what's the Stroop test? So the person writing this item spent a lot of time trying to figure out how to write this. Does this look like an easy item to write? No, they had to come up with the case, they had to do this whole thing, and they did all this work to test what's a Stroop test. That's what they said, okay? So something that's not an integrated assessment, like I said, we don't have validated tools, but we have a rough idea of what's not an integrated assessment. One is that we're assessing domains separately, okay? That's one way. The other thing is recall of clinical knowledge only, okay? You can't really show an effect if all you ever have to do is talk about the clinical knowledge and you never, ever, ever, even in formative assessments, question the basic science mechanism. So the features of integration that we want to highlight is this deliberate linking of concepts from across domains. Our emphasis is always creating meaningful relationships. We're trying to develop a semantic network, and the content, it has to be content specific. So these aren't abstract ideas. So what we want to do with test-enhanced learning is reinforce all of these processes with our assessments. So we want to create assessments that test connections. So I'm actually going to skip to the last thing, which is that essentially what you want to do is make assessments with why questions. Okay? That's how we're going to assess test-enhanced learning. So rather than saying, what is the Stroop test, what I might want to do in that earlier one is create an MCQ that asks, why was the Stroop test even recommended for this patient? What was the Stroop test going to tell us about this patient? That takes the question and turns it into a cognitive integration question. And you can do that with MCQs. So I use the example of a short answer, but you don't have to assume that it always has to be short answer. You can do this with MCQs. It's just difficult. So MCQs aren't fun to create. And so someone was asking about the supports that we offer. We do offer quite a bit of support for people, but the faculty members still have to create the items. So MCQs are great because we can get a lot of them, and they're easy to score. They're just not always easy to create. The way you use an MCQ, the way you design an MCQ, is still harnessing the response process. So figure out what process is being evoked by the item, and if that process allows them to get an application process opposed to a recall, you're good. You also want them to be processing the connections, not just the nodes. That's how you would create a cognitive integration MCQ. As you finish the day, everyone who was in the morning session, I know not everybody is here, so you can just think about it and use it as kind of a homework exercise. You were asked to create a semantic network. My suggestion is that you now take your semantic network and create one MCQ item, one short answer item, and one broader, bigger picture testing activity that you think would assess cognitive integration. How would you actually do this? And we don't have time to do it today, but you can take it as your homework. And I'll come back sometime and ask you all to tell me what you did, because we have to close the loop. So I think that's it. That's pretty much done. So we're going to stop here, and we're going to take any questions that you might have. Again, I'm going to thank our colleague Mahan Kulasegaram. He's the assessment guy. He's taught us, and then we came here and told you. So if you have more assessment questions, we're going to send you to Mahan, because he will help. But certainly for things on cognitive integration, adaptive expertise, the productive and unproductive failure, all of these things, this is the stuff we love to talk about, and we're happy to keep the conversation going. So if you start to look at these things and you start to play with them and you realize, wait a minute, I don't really understand what they were saying, fire us an email. We're happy to keep talking. We're going to send a list of references and resources that people can use. Some of them are our own papers, as well as the seminal papers that we referred to in the presentations. If you have trouble finding those papers, let us know. We're happy to fire them off. Most of them are pretty easily available. And yeah, thank you very much for the invitation. We've had a really great time visiting with you all. Thanks.